twist, voila. Okay. We have a very stubborn fungal nail infection that has been prescribed with all the benefit or itraconazole, had some laser treatment. So we can see that these ones are amazing. Actually, even after a year of going on all these treatments, this is the final treatment that we do. And today we're going to remove the nails. So we're just going to put the elevator underneath the nail plate and just gently move that, swing that across. And then just so this thing is in the way. So I'm gonna push the cuticle, not too hard, because we're gonna irritate the nail root. I feel like this is a bit attached. Go in, twist one, grab, twist two, twist. Twist, voila. Okay. Okay. What we have is just a little bit of damage, debris, fungus on the nail bed. So we're going to scrape that back. Kind of like removing dead skin, very gently, because you don't want to cut into the nail bed because you'll cause more damage. Yeah. So right now you would just focus on this kind of toe. Have a syringe, please. Anyone. Triple check. Remove, yeah, so I can see. Yes, there's a nail in here. I'll twist that out. Yeah, stay. There we go. A very short nail by that one. What bandage do we have? Medium or large? Medium. Oh, I'll put it on both bits. Sorry? I'll put it on both toes.
Yeah.
One each.
Oh no, just put one like one, yeah.
And a medium one.
Yeah, just put it on both.
Or do you want large?
I have got loads of balls. Maybe that's enough. Yeah. Okay. I've got that balls here too. Okay, fantastic. So that's done. Just going to dry the area. Should have got off time. You can see the color returning. Returning. Excellent.
Okay, Martin. Yeah.
Almost done. Yes, so we'll take a little bit like that for me, thank you. Just tape to secure. Okay, so how we tape to secure, you can keep on recording. Make it look pretty, okay? I want you to do it. Perfect. And so, you want to see your nails, or do you detach them now? No, that's fine. So we use, so circulation is good.
Yeah.
Before the surgery, on the left and the second, the refill times is the same. We put alcohol right before the surgery, and then we injected 2 mils and 1 mil, a total of 3 mils of local anesthetic. And there's no probably any infection. And we test the left first and second, and it was numb. And then before surgery, we put some antiseptic in it. And that was the procedure time. Obviously, we took an hour, but you can turn and everything. And then the bleeding after, which means that the circulation returns after. So we put 2 types of dressing, well, just like loads of dressing that we've got. Catagite covers that. That's woolly. So catagite is like a kind of like a gauze dressing. It's knitted, and then catagite on top, and then we can treat them balls and things like that. Right. That kind of stuff. Newports, defects, all that kind of stuff. You're going to be sitting here for up to 20 minutes, okay? If you want to, or you can get a taxi, and then once the taxi is